Good evening, everyone, and thank you for joining me tonight for an important discussion regarding the men's health topics of erectile dysfunction and male stress urinary incontinence. Um, we'll keep this informal, and my portion will be brief. I really want to leave plenty of questions for time for questions this evening. And as Christian said, please, while I'm speaking this evening, if you have questions come up, please put them in the chat, webinar chat box, so we can get to them as they come to your mind. I also have here on the screen my own website, wkymenshealth.com. It's a lot of good information. Everything I say tonight is on my website. So if you forget something or have other questions we don't get to, I have a lot of videos, a lot of frequently asked questions, a lot of other information that's a good resource there. A little bit about me. I am a urologist with Baptist Health in Paducah, Kentucky. I specialize in the treatment of erectile dysfunction and male incontinence. I spent several years in the Army as an active duty Army urologist, and I finished up active duty at Fort Campbell. So I've been in Western Kentucky since 2017 after leaving Fort Campbell, and I've been in Paducah since 2019. I have a passion for helping men with their men's health problems, specifically erectile dysfunction and urinary incontinence. I did train at Wake Forest University School of Medicine for my medical school training, and then I did my residency with the Army. Again, been here almost 5 years in Paducah, and encourage everyone to visit my website. I have my phone number listed here as well, and you can call that 270-442-3539 number after we're done tomorrow or in the next few days, and you can call and get an in-person consultation with me without a referral. So a lot of my own patients are on here tonight, a lot of our practice patients, but if you're not a patient of ours, please feel free to call and we'll get you in for an appointment to get your specific questions answered. I'd like to begin tonight by discussing erectile dysfunction, and we'll have time to talk about what it is, how common it is, and all the different possible causes. And we'll also cover all the different treatment options. Erectile dysfunction is extremely common. It is more common with advancing age, but it should never be considered a normal part of the aging process. You can almost go statistically, half of men by the age of 50 struggle with erectile dysfunction, and 60% of men at the age of 60, and 70% at age 70, and so forth. However, it can almost always be traced to a physical problem or disorder. And once identified, it can typically be treated, and we can return a man to satisfying sexual function in almost all cases. It is so common that ED, we estimate, affects well over 30 million of men in America, and that's actually more men in America that have diabetes. And so over the course of a man's life, we estimate that 1 in 4 men at some point will be affected by erectile dysfunction. So ED, as erectile dysfunction, otherwise known as ED, is defined as the inability to either obtain or maintain an erection sufficient for penetration. And it could be the complete inability to obtain an erection, or it could be the inability to maintain that erection. It's important to recognize the normal erectile process. When aroused, the nerves around the penis do become active, and the nerves control blood flow. And that, when the penis receives that increased blood flow, arteries swell, and the two spongy erectile bodies that run down the shaft of the penis, what we call the corpus cavernosa, they dilate and compress the veins around the corpora, and that allows you to maintain the erection. So we can have problems with arterial inflow, where there's not enough blood coming into the penis, and there can also be problems with what we call venous leak, where a man can get blood into the penis, but then it actually leaks out and also causes erectile dysfunction. The one of the more common causes of erectile dysfunction is age, but as I mentioned, it is never considered a normal part of the aging process. There are oftentimes multiple causes at play with erectile dysfunction, including vascular issues such as coronary artery disease or atherosclerotic plaque. The arteries going to the penis are even smaller than the arteries in the heart. And so men that have trouble with any kind of vascular issues, whether it's coronary artery disease or peripheral vascular disease, oftentimes have significant ED as well. Diabetes affects the nerves that control blood flow. And so diabetes is a big cause for erectile dysfunction, along with there are some men that have some medication side effects of ED. It's very rare for me to see a man who has a single cause of a medication causing ED. It is possible that if your primary care doctor starts you on a new hypertension medication, that may be, you may experience some sudden ED with that medication. But typically, as a man ages, it's going to be a multifactorial process, a little bit of cholesterol, a little bit of hypertension, a little bit of diabetes, and age along with that. And also tonight, we're going to be focusing on a lot of men that have that are prostate cancer survivors. And even though prostate cancer doesn't cause ED in and of itself, some of the treatment options that we have for prostate cancer can affect erectile function, such as surgery and even radiation. So it's important to know that ED is part of a man's battle with prostate cancer. And it is a very important part of prostate cancer survivorship. And I encourage men to not suffer in silence if they're affected by ED, because we know that ED can have a very broad negative impact on several health-related quality of life domains, as seen here in this diagram. Not only just overall quality of life, but the different things that are contributing to that quality of life, whether it's a man's general perception of his overall health or affecting a man's confidence and his ability to perform, or just overall physical functioning and different role limitations caused by ED. It definitely can affect a relationship. And I like to say that ED is a couple's problem, because yes, it's a men's health issue, but it also affects many domains of a relationship. And so I encourage you to not just seek medical treatment, but also discuss these issues with your partner, because that's extremely important as it affects the couple. Just a little bit, as I mentioned, about diabetes and the ED connection. 15 million men or so in the U.S. have diabetes. We already mentioned that over 2 times as many men suffer from ED. But that ED tends to occur earlier in life with men that have ED. And we do know that 1 in 2 men with diabetes have some element of erectile dysfunction going on. So it's important not to suffer in silence here. Other factors that may increase ED in men with diabetes, definitely how long a man has had diabetes, how the level of glycemic control that the man is achieving with diabetes treatment is also important, along with concomitant or what we call comorbid factors such as cardiovascular disease and other health issues impact erectile function. And as I mentioned before, ED is important to discuss with your primary doctor as well, because it can be an early warning sign of heart disease. Oftentimes, if a man starts having trouble not just obtaining but maintaining his erection, that can signify bigger problems with possible coronary artery disease, because the arteries going to the penis are even smaller than the arteries going to the heart. And so ED will oftentimes show up first before cardiovascular events. But so some easy things you can do to reduce your risk of ED as a man ages. Obviously, a healthy, balanced diet, getting regular physical activity is important. Losing weight can really help, along with smoking cessation and other lifestyle modifications can be important. And also, I'd like to mention in terms of prostate cancer treatment, these diagrams show the relationship of the prostate to the sphincter right next to the prostate, as well as the bladder. And so we know as urine travels through the urethra, it goes through the prostate. Well, in a man who has been treated with radical prostatectomy for prostate cancer, when the surgeon removes the prostate, we oftentimes do a nerve sparing procedure where we help try to spare the nerves that control erections. Those nerves lay in a very thin veil of tissue that lie right next to the prostate. And so even if even if the surgeon is able to spare those nerves do take a little bit of a hit around the time of surgery. And we have our patients who have recovered from prostate surgery go through some what we call penile rehab, where we try to reestablish blood flow and reinvigorate those nerves to help recover erectile function. And so, but it is common that right after surgery, it's common for men to suffer from ED, even temporarily. And we can, I tell all my patients, there's 3 priorities for prostate cancer treatment. The first is prostate cancer. The second would be preserving good urinary function, which we'll get to later in this talk when we talk about stress incontinence in a male. And then the third priority is erections. And it's not that the erections are not important. It's just that I can always get you an erection. And so that's why, it's just as important as the other 2, but it's just the third order of priority, so to speak. We can see here that overall erectile dysfunction does affect up to 75% of men after prostate cancer treatment, whether that's surgery or even radiation. Even if you don't have surgery and you receive pelvic radiation for other malignancies, not just prostate, the blood vessels receive that radiation, and so do the nerves receive some of that dose of radiation. And so it is true that a lot of men can recover erectile function after prostate cancer surgery, but here in one study, 1 year after surgery, a range of men, 10 to 46% of men had some degree of ED after recovering from surgery. And sexual dysfunction after radiation was noted in up to 50% of men. So it's a very common part of prostate cancer survivorship. I also really need to mention what we call Peyronie's disease. And you probably have seen a lot of commercials on TV with a picture of used to be a banana, and now then they went to a carrot, and signifying kind of a picture of a bent penis or a curved penis. And Peyronie's disease is also a very important men's health issue that can affect erectile function. It was named after a French physician hundreds of years ago that diagnosed it in King Louis XIV. And so we don't know the exact cause of Peyronie's, but we do know that over time, it's a scarring process that occurs around the erectile bodies of the penis. And we think it's probably due to micro trauma of buckling and shearing forces over time with the erection. Some of my patients can relate and can remember a popping sensation or an actual significant injury that they suffered in the past, but oftentimes they just first start noticing penile curvature. And that curvature is due to the body laying down this fibrous plaque or scar along the tunica albuginea, the fibrous covering of the erectile bodies that run down the shaft of the penis. And that plaque causes not just curvature, but it also causes a loss of penile length and girth over time. And it also over time causes progressive worsening erectile dysfunction that oftentimes is not as responsive to medical treatment. And so it's a really debilitating men's health issue. And it's not normal, but it's very common. And so if you're suffering from penile curvature, loss of penile length and girth, it's important to see a specialist like me so we could talk about different options that are out there. But it does cause a lot of stress and anxiety along with the ED, and stresses on the relationship as well. As I mentioned, the symptoms could be those plaques. You can oftentimes feel those plaques better when the penis is in erect position. But the penis doesn't have to be curved. Sometimes it could have kind of an hourglass deformity, or you can have kind of a narrowing of the shaft or a hinge effect where there's loss of stability somewhere along the shaft caused by those plaques. And over time, that scarring creates kind of a web of scarring down the shaft in those erectile bodies. And so over time, there's not just worsening ED, but also loss of length and girth as the scarring takes over the penis. And so oftentimes the first 6 to 12 months of the curvature, and when a man notices Peyronie's, it can be associated with some pain and discomfort with the erection. That's kind of the active painful phase. And then after the pain goes away, the curve will generally stabilize out one way or another, and the pain will go away. And so you really don't want to treat Peyronie's actively during the active painful phase. But after that painful phase had resolved, which during the active phase of the process, we typically, the mainstay of therapy is daily vitamin E as an antioxidant, just over-the-counter vitamin E. We think that can help minimize and reduce, slow the scarring process. There are some traction devices that are sold online, even on Amazon, that you can get. There's some decent data out there that says that maybe putting the penis on stretch can slow the process from occurring, but it really doesn't treat the ED part. And so that's where Peyronie's can be a big factor in some men seeking treatment for ED. And I'd say probably 30% of my patients easily who are seeing me for ED have some component of Peyronie's disease when I ask about not just curvature, but history of curvature or some of these other deformities that can happen. The commercials you're seeing on TV for Peyronie's are typically for this the injection called Xiaflex, and this is not a talk about Peyronie's. We could talk for another hour on Peyronie's. However, the Xiaflex injection, that's what they're advertising. It's an enzyme that some doctors try to inject in that plaque to break it down. I do not perform Xiaflex injections. I don't think it works all that well. I think there's a role for it in men who are potent, who are not yet suffering from ED. But most of my patients, when they're seeing me not just for Peyronie's, but Peyronie's with erectile dysfunction. And so if you're already dealing with some impotence or ED, it does no good to straighten the penis with what you see here, the plication procedures, or trying to excise that plaque and graft it. You can straighten the penis, but then what good is it if we straighten it and it won't work? And so some of the treatment options we talk about tonight are important because they treat both ED and Peyronie's disease, which we'll get to that here. We'll be able to cover all the different treatment options here, and there's a spectrum. And I would say as we move from left to right on the screen, you can see that there's an array of different treatment options available, and there's been an explosion of telemedicine, telehealth, male health services online that try to get men prescriptions for medications, and that's been actually good to raise awareness of ED. The problem is you're not seeing a specialist. You're not seeing someone that really focuses on ED like myself. And so it's important as we move along these treatment options that yes, discuss them with your primary provider. But if things aren't working out with the oral medications or whatnot, and you're needing to don't suffer in silence, because not all urologists focus on erectile dysfunction treatment. It's important to see a specialist. The first treatment option for erectile dysfunction typically involves oral medications. We're all familiar with these drugs that we call PDE5 inhibitors, such as Viagra or Cialis or Levitra. These medications all work in a similar fashion to increase blood flow, dilate blood vessels. They dilate blood vessels and increase blood flow all over the body, not just to your penis. And so you oftentimes men have some element of headaches or stuffy nose or backache or stomach upset side effects because they can feel a flushing effect or that increasing blood flow. You have to take these medications on an empty stomach at least 30 to 60 minutes prior to sexual activity, so it has time to set up. And if you take it with food, you're not going to absorb the medication. So it's important to take it ahead of time. It oftentimes like Viagra will work up to 8 hours. Cialis has a little longer half-life, and it will stay in the system for easily 24 hours, not to be taken more than once a day. And they can be effective initially in treating ED. In fact, that's the first step that we typically go with. There are, you know, over time, these medications will either become less effective over the years, or patients will have they'll be less tolerable, and patients will have side effects from these medications. It's They used to be very costly. Now you can get them; they've all gone generic, and so any nurse practitioner or doctor can prescribe the generic Viagra, which is sildenafil, or the generic Cialis, which is tadalafil. Those can all be perceived by prescription. As I mentioned, the most common side effects are facial flushing and stuffy nose and headache. It is important to know that if you take nitroglycerin or any nitrate medication, you should not take any of these medications, because they can drop the blood pressure, and they can actually be very life-threatening if taken with nitrate medication. So if you're on those, if you carry nitroglycerin in your pocket, or take any nitro whatsoever, Imdur, isosorbide dinitrate, any of those medications, and be sure you do not take these medications, and consult your physician. Over time, as the pills start losing effect, there are other treatment options that are available. There are penile injection treatments that are out there, otherwise shown here. The brand name of, say, alprostadil is Caverject, which comes in a box. It's very expensive at the pharmacy. We typically use something called Trimix, which is made by a compounding pharmacy out in California that we use mail order. They're very customer friendly. But that actually is where a man goes to the refrigerator, draws up a needle with a syringe, the liquid medication, and injects that medication into the side of the penis. And it creates an artificial erection, allows the medication to work directly where it needs to. And it requires some planning. You have to be by the refrigerator. It takes 15 to 20 minutes for the erection to set up. It's possible to use too much, or you might, it might cause significant penile pain with the injection. It's not very spontaneous. A lot of men, honestly don't want to put a needle in their penis. And so I actually use very, very, very little penile injection therapy in my practice. It's an option. It's important to know about it. But over time, the repeated placing of that needle in the side of the penis, it will create some element of scar tissue. And I've seen men that have developed Peyronie's disease because they inject the same place every time. So even if you try to alternate sides and alternate where you inject on the shaft, it's possible to have problems with Peyronie's or scar tissue. It's also possible to have priapism, which is when the erection lasts longer than 4 hours, and we have to actually do emergency treatments to bring the erection down. So it's important to, if you deal with injections, to use a very small amount, and you have to adjust the dose based on how much is required. And so it takes some extra steps there to find the right dose that's right for you. One of my patients told me the other day, just he couldn't take, you couldn't do the injections anymore. It was like giving himself a penile migraine. It's kind of another aching. Instead of your head is aching, your penis is aching after you do the injection. I've never met a man that's long-term pleased with injection therapy. I think it could be a good bridge, especially right after prostate surgery, when you're trying to do as an element of penile rehab. But eventually men will get tired of putting a needle in their penis, or just don't want to do injections to begin with. Another treatment to be aware of is what's called a vacuum erection device, or a VED. And that's actually creates another form of artificial erection, where a tube is placed over the shaft, and we use a vacuum pump to pull blood into the penis, and there's a constriction band slid down over the base of the shaft to try to hold the blood in there. These could be purchased on Amazon as well. No prescription required. Either a hand-powered or a battery-powered vacuum pump. I oftentimes get complaints from patients about the ring being uncomfortable, the erection quality not being as hard as they would like, the temperature being cold, restricted ejaculation. you know, it's sometimes it's very hard to get a seal around the base of that canister at the bottom of the shaft. And so a lot of patients who try VD, they'll use it as part of their rehab program, but most patients will quickly move on from a VED once they try it because of these side effects that you can see here that we talked about. Another option that I use very little of in my practice are urethral medications, whether it's a suppository that comes in a box from the pharmacy or gels that you actually place into the urethra to try to get the medication to dissolve directly into the penis without using a needle, but with a medication in the urethra. It can be effective for some men. I'd say easily 30 to 40% of patients have such bad penile burning and pain side effects that they don't like it. And in fact, the gels that we get from the compounding pharmacy, they have to actually put lidocaine in the gel to try to numb up the urethra. It can burn so bad. So, and it can also, you know, cause the partner some side effects as well from the urethral medication. So, but it is another option. Over time, these medical options such as pills, injections, suppositories, or vacuum devices will become either less effective or less tolerable. And whenever that occurs, one durable and reliable and dependable option is a penile implant. And I do over 100 penile implants a year, not because I taught men into them, but because it works so well. And it's the only treatment that has a 98% patient satisfaction rate. And the reason the satisfaction rate is so high is because when you go with an implant, it's completely discreet and concealable. It's all up underneath the skin. No one knows you have it. And it restores that confidence that you're going to be able to get an erection whenever you want to get the erection, and it will last however long you want it to last. And so it becomes part of your own body. And it's you know, I view it as a reconstructive procedure, just like women go get their breast reconstruction after surviving breast cancer. However, in a man, this is part of the man's body that should work. And so when a man is suffering from erectile dysfunction, an implant is not a cosmetic treatment. It's actually a restorative treatment. And it, you know, as you see that here, the data show that at 7 years, well over 94% are still in use, and patients are pleased with it. If anything, I hear from my patients, I wish I would have done it sooner. And the reason is they've struggled with so many years with medications that don't work or that are not reliable. And it might work one night, and the next night their confidence is destroyed because their treatment didn't work, or it didn't work as long as they wanted to. And they want to take control of their health and have full control of their erection. So I have a few videos to show, but you know, if you see me for an in-person consultation, I'll be able to show you the different models and implants that we have. There are malleable devices that are used for men that don't have good manual dexterity and use their thumbs, but typically the most common implant is a 3-piece inflatable penile implant. And that, and I'll show you briefly, there's 3 components. There are 2 cylinders that run down the shaft of the penis. There's a reservoir that sits up underneath the abdominal musculature, way down by the bladder. And then there's a button in the scrotum. And when you want to get the erection, this is all up underneath the skin. It's all concealed. No one can see this from the outside. But when a man wants to get the erection, he reaches down into his scrotum and he pumps his scrotal pump, and it transfers the salt water from the reservoir to the penis, and it gets hard on demand. And so you can see, and you'll see in the videos I show here momentarily, that these cylinders are inflating as I pump this up, and the penis gets hard, and it stays hard, and it stays hard for however long the man wants it hard. And several of the models, they not just maintain length, but they actually improve girth. And so you can see as this is inflating, it's getting thicker, and the penis stays hard. If I could make a penis longer, I'd be rich. There's no way to do it. If you meet a urologist that tells you they can make the penis longer by cutting the suspensory ligament or fillers or things like that, it's just stay away from that. I will say that an implant will stop the loss of length and girth, especially for men who suffer from Peyronie's disease. And with an implant, it maintains your length. And so as you use this, it will improve both girth, and it maintains your length, and it will stay hard as long as you want to be hard. And then there's a button here on the side. When you finally want to go down, then you hit the button and it deflates. And so it goes back, you could go back to wearing a Speedo at the beach if you want. No one can see this underneath the skin at all. It's especially for Peyronie's disease, where men have lost that length and girth. A penile implant is a excellent treatment option that kills two birds with one stone, so to speak. It treats the ED, and it also is an excellent treatment for Peyronie's, especially when they have the curvature, because we can actually straighten the penis over the implant. And so, and it stops the damage where it's at. And over time, you can regain length by using the implant. I liken it to physical therapy, where we inflate and deflate and inflate, deflate. It actually stretches against all the scar tissue. If you go to someone like me that's a high volume penile implant surgeon, an implant is an outpatient procedure, takes 30 minutes, go home the same day, very little pain. Most of my patients only take 1 or 2 pain pills. They're going back to work the following week. So generally about a week off work. And we wait about 4 to 6 weeks before we start showing men how to use it. But it very few side effects. 99% of the time, everything goes just fine. There's also, as with any mechanical device, there's a risk of having a mechanical malfunction over time. Eventually it will wear out, but you can easily get 10 to 20 years out of an implant. And only a 1% risk of infection. If you go to someone who's a higher volume surgeon, infection is extremely rare. Usually the only problems occur when people don't follow the directions. I'd like to show you, this is an animation of a 3-piece inflatable penile implant. This is a Boston Scientific AMS 700, which is we've been doing for decades. Excellent option for men who are suffering from ED. And you can see the 2 paired cylinders that are running down the shaft of the penis, and there's that control pump in the scrotum. And this, as you press that control pump, it transfers the salt water from the reservoir, which is down here by the bladder, and goes to the penis, and it gets hard and stays hard as long as you want to be hard. And then when you're done, you hit that deflate button, and the penis goes back to being soft. So sensation's the same, ejaculation's the same, everything's the same with an implant. It just allows you to have an erection whenever you want to. Now, this next video I have does have some nudity in it. It is an actual live patient demonstration of inflation and deflation. So if you're not in an area where you'd like to see a medical image, either step away or come back and join us here in a couple minutes. The video is only about a minute long, but let me get, this is a good demonstration of, just so you can picture what I was holding in my hand. This is in the patient. 2 cylinders that run down the shaft. There's a control pump in the scrotum, and the patient here does a pretty good job of demonstrating the control pump. You can't see the reservoir, of course. It's down behind the bone next to the bladder. No one can see any of this from the outside. So a man is flaccid, and he's squeezing. There's different ways to squeeze it, but he's locating this pump in the scrotum, and every time he squeezes that pump, it transfers salt water to the cylinders. And this is kind of a fast forward here. I don't count how many times we squeeze the pump. You squeeze it until you can't squeeze anymore. You can't overfill it. But when you get to a point where it's full, it's going to be fully erect. And he turns the side so you can see. You can't see any of the material underneath the skin. And when he's done with the erection, he'll show you the deflate button, which you could see actually right now on the side of the header right there. He pushes the deflate button, and it moves the valve across, and then you can squeeze the penis and accelerates the deflation process, and it goes back to a flaccid position. And a lot of my patients don't walk around with it completely deflated. A lot of my patients leave some fluid in the cylinders to provide some level of fullness, and a lot of my patients do enjoy having that confidence that it's there whenever they need it. And they can to be honest, find their penis better. They can use a urinal better, and it just they walk around with their head a little higher, so to speak, with the confidence that they no longer suffer from the ED. As I mentioned, some of the benefits of an implant, Um, I tell my patients in the office, I don't sell penile implants. The penile implant sells itself. It's the only solution that's a permanent solution for erectile dysfunction. It's the only one where it's spontaneous, and whenever the mood is there, the treatment is ready to go. It's the only treatment that lasts as long as you desire. Most, not to be crude, but sensation is the same, ejaculation is the same for the man. But once a man climaxes, he maintains the erection. It will not go down until he's ready for it to go down. So you can go where your mind takes you with that. But a lot of my patients enjoy that freedom that they have. They no longer have any trouble with stamina whatsoever. It's entirely contained inside the body. No one knows you have it unless you tell them. I tell my patients, if someone asks you, tell them you had a reconstructive procedure, which is a truthful answer. And I think the taboo's fading from erectile dysfunction treatment. We've had medications out long enough. Men have suffered long enough with decades of treatment available. And now the patients that kind of have grown up with Viagra, so to speak, are now ready for other solutions that are going to be longer lasting and more durable. It does not interfere with ejaculation or orgasm. In fact, most of my patients tell me that it's actually more pleasurable because those centers in the brain that control those functions can focus on doing what they're supposed to do instead of focus on maintaining the erection, and the stress and the pressure is gone to hurry up and finish before the erection is lost. We've been doing this for decades, nearly 40 years, and over 500,000 patients have been treated with an implant. And I personally have over 300 patients walking around Western Kentucky who have an implant and who are very satisfied and telling their friends about it, and they're coming to see me. It's important to note that unlike erectile dysfunction medications, such as the oral medications, the injections, the suppositories, a VED, the insurance does not cover any of those pills or shots or gels. But Medicare and almost every other policy that follows Medicare guidelines, most insurance policies do cover an implant as a treatment for organic, or what we call erectile dysfunction that's caused by a physical problem or disorder. And like I said, over 80% of the time we can trace it to a problem. And so I view erectile dysfunction as no different than diabetes or hypertension. It's another medical issue that deserves to be treated. And so, I tell my patients all the time that insurance makes money by trying to say no, just like our home insurance, or, so sometimes we get a denial here and there and we appeal that decision. There are a few plans out there that have select smaller employer plans that have plan exclusions, but those are becoming less common. And Medicare approves this 100%. And generally, most other insurance coverages do cover erectile dysfunction treatment with a penile implant. So it's important to not suffer in silence and see a specialist like me. It's important to know that it is a surgical procedure. Once you go with an implant, you never go back to having an erection on your own. You never need to put a needle in your penis again, or a lot of my patients do take some Viagra or Cialis because you do get some natural blood flow around the urethra and to the glands, or what we call the head of the penis. And so they enjoy that, taking an occasional PD inhibitor, but you don't have to. And it does, over time, as I mentioned, you can easily get 10 to 20 years out of an implant. If and when it does wear out, and I'll tell my patients, I hope you do wear it out. It means you're using it. If it goes down and there's a mechanical problem, we can do a removal and replacement where we easily take the old one out and place a new one. And if anything, we usually go up a size, and men have gained length by using an implant regularly. Like we go back to that physical therapy analogy. So in summary, ED is not just a common problem that oftentimes is associated with other medical conditions, but it's an important men's health condition in and of itself. And it's important to be aware of all the different treatment options. And if you've tried pills and you're not happy with the side effects or the results and don't want to put a needle on your penis, penile implants offer a great permanent solution that's discreet and reliable and durable. And it's the only one that offers a 98% patient satisfaction rate. So discuss it with your partner. I always recommend that. It's a couple's problem, but it's important to talk to a urologist that specializes in erectile dysfunction treatment. Most urologists don't do what I do. I'm the only one in Paducah that typically does anywhere near this number of implants. Actually, the only one in the tri-state area. I have patients from Southern Illinois, West Tennessee. I've had patients from Nashville coming up to see us here in Paducah. So you want to go to see a specialist, and I would point you to, there's a website here, edcure.org. edcure.org is a great resource for patients. And it's managed by Boston Scientific, and it has some physician locators on there. So wherever you're located, they have the specialists that do this kind of work listed, and they have a lot of great information, including what we call the HARD series, kind of a video series of patient testimonials about patients that have gone through the ED journey and treatment and what they were thinking before and during the treatment and how they're doing now after getting treatment. So excellent resource there to go with. So also want to leave some time to touch on a male stress urinary incontinence, because a lot of our patients I know are prostate cancer survivors, and either with surgery or radiation, and even with some treatments for benign prostate enlargement, men can suffer from leakage of urine. And we define stress incontinence as leakage of urine with physical activity. So we all know that the urine leaves the bladder, travels through the prostate, and you can see here the sphincter, the external urinary sphincter, sits right next to the prostate. Well, when you have the prostate removed, that sphincter is still there, but oftentimes that sphincter is weakened and is not as strong as it once was. And so very commonly, right after the catheter is removed after prostate surgery, 100% of men have very poor urinary control. Most men after prostate treatment do regain full urinary control, but 3 to 5% of men do have long-term leakage with physical activity. And so it's important to not suffer in silence, because there are very effective treatment options. And you can see one study, that between 9 and 16% of men, I think in our practice, that's a little high. I'd say it's under 10%. And we have Dr. Knox and Dr. Spicer who do great robotic surgeries here. Don't see most patients are coming to see me for ED. However, they oftentimes co-occur. So men are coming to see me for male leakage problems. We can also treat their ED at the same time, and so they don't have to be treated separately. We can treat them in tandem, so to speak. But I'm not talking about leakage when you can't get to the bathroom soon enough. I'm talking about leakage with walking, jumping, laughing, coughing, even just getting in and out of the truck. And some men are wearing only 1 or 2 pads a day. Some men are wearing pull-ups or heavier pads. And it's a huge quality of life issue. You can see that here that it has a big impact on quality of life. When men are worried about smelling like urine or worried about having to change a pad. I tell men after prostate treatment, the first year or two, 1 to 2 years, the patient's generally getting better. We do the Kegel exercises. There are treatment options we can do to help rehabilitate that sphincter. But prostate cancer treatment is very common. Approximately 70,000 radical prostatectomies each year, and up to 1 in 10 of those men have some issues with leakage. It's normal immediately following the surgery, but it's not normal when you get to that 1 or 2 year mark and you're still wearing a 1 to 2 pads per day. It's not normal, and men will oftentimes eventually want to get on with their life without having to wear a pad. Of course, there are non-invasive treatment options. I mentioned the Kegel exercises, the pelvic floor physical therapy that we all talk about, doing those exercises to strengthen the pelvic floor. No one wants to wear pads long term. No one wants to wear pull-up. Penile clamps are not satisfactory. They're uncomfortable, and goodness knows no one wants to wear a catheter. But it's a big burden both on time, and if you look at just the cost alone over 5 years, if a patient is wearing up to 5 pads per day, that adds up to thousands of dollars over a long period of time. Not to mention the trips to the store to get pads and having to worry about changing them. So the gold standard on the right side of the screen, the gold standard in male incontinence is the artificial urinary sphincter. The only one on the market is AMS 800. It's a great device. It is designed to replicate the function of the external sphincter. And we'll get to that treatment here in a moment. It's made for men who have very, very poor urinary control or have had radiation after their surgery and are wearing heavier or using heavier pads, multiple pads a day, 4 to 5 pads per day, heavy soaking, no urinary control. That's where we talk about an artificial urinary sphincter. Most of my patients fall to the left side of the screen where you can see the male sling, which is these men are wearing 1 to 3 pads per day, mild leakage, sometimes only 1 pad per day, or sometimes only when they're working out, or only during intercourse, or whatever the case may be. But they have mild or leakage, and their sphincter is still working, but it's just not quite strong enough to keep them dry. And so a male sling actually helps to augment or support the man's own anatomy. And I don't have a video of this, but if you see me in the office, I can show you an actual sling. This is these paper coverings come off, and you can see this is the same type mesh that we use for hernias. And it's a specialized sling we've been doing for slings for women for incontinence for years, but this is specifically a male sling that's made to actually serve as a hammock support and actually restore that support that's missing after a man has lost his prostate. And so it helps his own sphincter work better. The benefits of a male sling, when we put a sling in, this is a 30 to 45 minute outpatient procedure, 1 poke hole behind the scrotum. It's very little pain. And the nice part about a sling is it's a set it and forget it. You put this in, you pull up, and it helps restore that support up underneath the urethra. And patient goes home the same day, wears a catheter just overnight. Next morning, the catheter comes out at home, and the man notices an immediate benefit. Immediately, that sling is supportive, and he's leaking less from day one. Now, it is take some time to recover. We don't want a man lifting over 20 pounds for the first 6 weeks. We don't want that sling to move or slip. So, but there's no moving parts. The sling stays put and is active from day one. The benefits of an artificial urinary sphincters, as I mentioned, there's some men that just wear more than 3 pads per day or have had a significant radiation after surgery, and their sphincter muscle is so weakened that it's open and not able to coapt on its own. And we need to actually use an artificial sphincter. And I can show you this quick video as we wrap up on incontinence. That this is a video of the AMS 800 artificial urinary sphincter system. And here there's a small cuff that goes around the urethra, almost like a small blood pressure cuff. And there's a control pump in the scrotum, and there's a pressure regulating balloon that sits up underneath the abdominal wall. And so when a patient is at rest, this cuff stays inflated, and it serves to close off the urethra. When a patient wants to void, he could reach down and give that pump a couple of squeezes. That cuff opens up as it did here, and he passes the urine. And then the fluid actually moves back to the cuff and reinflates on its own. So the patient pushes the button, it opens, he can void, and then over the next couple of minutes, it recloses down. And so the patient can actually stay dry in between voids. So this is another website I encourage you to look at. Fixincontinence.com is a great website. A lot of good resources for male incontinence. A lot of additional information about not just sphincters, but also male slings. And it's important to meet with a urologist that specializes in this kind of work. And again, I'm the only one in Western Kentucky that typically does sphincters and slings. And we do a lot of them here and have had great results and very high patient satisfaction rates. Again, they are surgeries. It's important to know that there are risks with any surgery. With a male sling, we're not really talking about any mechanical malfunction because there's nothing. If you follow the directions and take it easy for 6 weeks, you're living life, but just not heavy lifting or climbing ladders where you're putting a lot of stress on that sling. Very high patient satisfaction rate, up to well over 90% with a sling. Artificial sphincters can have some mechanical issues because over time the urethra can get thinner underneath the cuff, or you can have revision. But again, if you're looking at 5 to 10 years of having dryness, a lot of men will take that. It's just such a significant quality of life issue that those are the best 5 to 10 years of their life that they're not wearing a diaper. So it's important to talk about those treatment options. And again, insurance covers this. Medicare, if anything, coverage is better for incontinence, and because it's part of your prostate cancer survivorship. I'd like to leave time for some questions. Again, right here on this site, as we move to questions, wkymenshealth.com is my own website. I'd encourage you to visit that. It has my phone number listed here, and on my site you can call, get an appointment with me with no referral needed. If you hear you need a referral to talk to me about erectile dysfunction, please ask to speak to my manager, because unfortunately, sometimes our scheduling is done through the Baptist Hub in Louisville, and I've tried to tell them red in the face that I don't need a referral for men wanting to talk about ED or incontinence, but sometimes we have a new employee up there in Louisville that doesn't know us in Paducah, that they just don't, they give you bad information. So I don't want anyone to not get care. So you can also, leave a question here, and